Mark Pappas. I'm the Executive Vice President of Innovation at CMI Media Group. We're part of the WPP network holding company, however you like to describe it. I work across all of our accounts at CMI to work with new innovative partners to bring a lot of new first market opportunities to all the different brands that we work with. And it could be anything from AI, which I know we're going to talk a lot about today, to sports, to gaming, really all over the map. But it's all about driving change and bringing new things to our clients.
Welcome to Next Marketing with AJ Season 2, where we decode the future of marketing, one episode at a time. Today, I have with me Mark Pappas, one of the senior leaders in the advertising industry and leading the media space. Welcome, Mark, to first episode of Next Marketing.
Well, thanks for having me, and very honored to be the first episode of Season 2.
We want to focus around AI. Right? We can't not talk about AI. That's everywhere. But is it hype, a shiny object, as we say in pharma, or is it real? Like, especially if you want to focus it around healthcare. So what's your opinion? What do you think?
I think it's all of the above, depending on how you're using it. Lots of times people hear AI, they immediately go to generative AI, but there's the whole machine learning aspect of it. And, AI is one of the most, or if not the most powerful tool that has really come around. And it kind of reminds me, like right now, it seems like a lot of people think like the sky is falling, like everyone's going to lose their job to AI. But, I think it's kind of similar to when like Photoshop and things like that came out, when all the designers thought that the sky was falling because now you could do all this, like there's all this manual work is now done in like, 2 clicks in Photoshop. So I think it's an amazing tool. I think it's just very important that you know how to harness it properly. And in pharma and healthcare specifically, there's millions of applications for it.
I think any meeting you go to, any presentation you go to, any platform you go to, I'm sure you meet a lot of businesses. Everyone talks about AI, right? You come across, meet a startup, we use AI. How do you kind of validate or look at, is it real or is it just a marketing terminology?
Yeah, and this is like an ongoing struggle that I have on a daily basis, because my team is constantly meeting with new suppliers, and now everybody has to have AI included somehow on their platform. And lots of times, like I'll be honest, it's a bunch of crap. It's like, it's just garbage that they're trying to shoehorn in some kind of thing saying it's AI, when in reality, they're just running like an API call to ChatGPT to just bring something in. But I think that's one of the biggest parts. And like, at CMI, I mean, we have our supplier partner team who does a lot of like vetting and due diligence to make sure that, these brands aren't just completely full of crap. And, I'm trying to watch my language here, but making sure that it actually is providing a value and it's not just a shiny object. Because, with anything that my innovation team brings forward, like we always say, like, there's a million shiny objects we can dangle in front of a client, but we want to make sure it's like solving a need and solving like a business purpose. And so we want to make sure we're doing the same thing with any of these companies that are saying it's AI or anything like that. And lots of times, we've had partners come to us where we do some digging and we'll see it's like, it's a bunch of like, sales or media people that might have gotten someone to build something like cheap and, try and like shoehorn in a bunch of ads to run. But then we have other platforms where it's actual AI developers from, Harvard and MIT that are like, okay, let's probably go with this one versus that one. But yeah, the due diligence is the biggest part, because when it comes time to put that in front of a client, and if they want to move forward with something, the next huge hurdle is going to be regulatory. Okay. And regulatory is going to ask every question about.
Have you seen, and it's interesting, right? Across categories like healthcare or consumer, right? Do you see, especially in healthcare, people have a lot of like claims or a lot of smokes and mirrors?
Oh my God, yeah, it's so much. That's why
I consider healthcare such a regulated category. You have to like go by the book. There's regulation, fact, but we also see a lot of smokes and mirrors. Like anyone can say anything and you can't validate.
Yeah, I mean, there's so many times we'll get stuff from a new vendor, and it says that they have like 1 million HCPs using their platform. I'm like, I don't know if there are 1 million HCPs in the U.S. But then it was, but then you do some digging, and it's literally just smoke and mirrors.
What are the right questions to ask?
I mean, one, are you HIPAA compliant? That'd be a first point. But if we're talking AI specifically, I'd really want to know, like, what data is it being trained on? Where is it pulling information from? What's happening with the questions being asked by a physician after they ask it? Like, is it being stored anywhere? There's a lot of stuff like that, because most of the questions coming from regulatory are going to be related to privacy, related to data and security. So making sure you have a lot of that buttoned up, and being able to answer any of those questions, I think is going to be like probably the first big hurdle. Like that.
Like for strategy, like healthcare is one of the categories which produces largest amount of data, right? Each second. Do you see even strategists using a lot of data and AI?
Yeah. I mean, we're, and I don't know how far I can get into it, but I know with internally, I mean, the amount of data that we have generated from campaigns and the amount of like PLD data that's out there and things like that, it's one of the things we've run into constantly over the years, where every supplier has their own set of data, but now it's like being able to harness all of this and have an AI platform that's trained on all this data to help us look at all these different data sets to really make decisions on where we need to be focusing, where we need to be spending, what business decisions can be made based of like this, it's a data lake, really. There's so much data being generated right now. The other way that we're really seeing AI being leveraged now, at least internally at CMI and with some of our clients, is just being able to harness all of the data that's being generated from all these different campaigns out there. And then, looking at programmatic media specifically, we work with partners where we can build individual AI models on a campaign by campaign basis, where they're doing nothing but taking all these different signals and optimizing on the fly. And it's doing it in a way that no human could ever do. And then, at the same time, we're leveraging it to really flight and launch campaigns and completely taking the possibility of errors out of a lot of this, and the time to market speed has been drastically slashed with a lot of this. So I think it's being harnessed in ways that's freeing up a lot of the manpower internally to really focus on more strategic thinking versus administrative and more of like the day-to-day, of the campaign management side of things.
So improving efficiency,
Exactly.
Improving performance.
Plus, it's like, it's doing something like, obviously you can use AI for ad campaigns and trafficking and everything else, but the strategy part of it, the meeting with vendors and coming up with like custom opportunities and things like that. Like, I don't think AI is doing that yet. I hope not. But that's where it's like, we can now have staff focus on that versus, using up all of their time just like flighting campaigns and things.
There's more for providers, right? How it can be useful for them.
Yeah, I mean, I don't want to say it's only for providers, but that's where I've seen the most traction from on the pharma and healthcare side, has been from the providers being able to access, information they never would have had access to before. One of the stats that we hear a lot is that medical research globally doubles every 5 years. And if you think of a doctor that's been in practice out of med school, they go through a residency, they're already beyond 5 years. So everything they learned in school is now obsolete, other than typical biology. So, for a doctor to be able to keep up with the amount of medical research that's published, and I think one of the other stats is I think there's 2 studies published every minute of every day. A doctor would have to read for 7 hours a day to be able to keep up with it, which is impossible. So being able to have these tools that can basically access all of this data globally and provide you an answer within seconds is one of the most revolutionary things, and it's literally saving lives.
Yeah, for a physician, it's not possible for a physician to remember. I think not just research, right? Look at the clinical trials that are happening, look at all those affordability programs that are happening. A physician cannot remember about everything.
Yeah.
So any technology, I think, that can help him is very useful. So yesterday I was at a round table with some health system CIOs, right? And they were sharing insights on how physicians are so excited and adopting usage of AI. They're kind of working on the similar problem which you shared. There is so much they can't remember, right? And they are coming across tools which they want to use, which is helping them in their day-to-day life. Like someone shared that They have hired like 70 case managers, and their job is to just go online and start searching which affordability programs are available. I said, in this world of chat GPT, like, why do you need those kind of people?
Yeah.
Like, you use Epic, why can't it show up in the workflow? Often at times I play the role of a physician, and sometimes I become a consumer. And we were trying to understand like this behavior, and we did a research and found out, right, how physicians search is very different from how a consumer searches, right? On like the kind of words that you would use. Like a consumer would use heart, a physician would use cardiac, cardiology, right? Things like that. So very different, right? So when you kind of create those search marketing campaigns for a physician, it's a very different keyword set.
Yep. Yeah, and typically you see like the branded searches on consumer, generic on the HCP,
Correct.
mechanisms of action, things like that, more dosing, administration type stuff. So but now this is kind of, I think now the physicians are seeing like how complex of questions that you can ask. What they're asking is, you're not putting a keyword in an AI platform. You're putting in like a paragraph, really, So it's just
Prompt.
and it's generating that much more data that we can really get insights
Yes,
from.
prompt engineers would be most in demand.
Yeah, I mean, we joke around internally, but I honestly think like we're gonna have positions where it's like prompt engineer is like like search prompt engineer or something like that, where it's that's like a core part of the job. I mean, with 2 years ago, none of us were really talking about Chat GPT or anything. It didn't exist, and now all of a sudden it's like an indispensable tool for just about everybody in the industry. So it's just mind blowing how like I can't remember anything changing in industry so fast in such a short amount of time.
Yeah, I know. Every day you wake up, there is something new has happened. I have a 9-year-old boy, and he uses ChatGPT to answer his questions.
It's funny. I use ChatGPT to help me solve my 9-year-old daughter's homework because I don't understand new math, and it boggles my mind. So I literally take a picture of the problem.
See, for them, this is kind of default, right?
Yeah.
That's how it works.
Yeah, and that's why I had this conversation like with my wife a lot, where what is college going to be a thing in 10 years? Like, what's it going to look like? Where it's like you have access to every piece of information at your fingertips in seconds, and it's like but like actual, not like Google, but like real like deep responses and information. Like what, like especially with coding, like anybody can create anything now in seconds. You see like 9 and 10-year-olds creating apps and all these like businesses leveraging ChatGPT. It's mind blowing. So who knows? Like if we're 2 years in with like ChatGPT,
very different world in next 5 years.
It's gonna be it's terrifying but exciting. So I just hope as long as Skynet doesn't come around, I think we'll be okay.
So let's move to the next section of this show. It's a rapid fire round, right? Simple, easy. I ask you a few questions rapidly, and you have to answer whatever first thing that comes in your mind.
Okay.
Right? So quicker the better. Are you ready?
I'm ready.
First question, right? How would you define AI in one word? Is it an enabler or a disruptor?
Enabler.
One healthcare AI trend that excites you the most?
I think the access to the clinical research globally. I don't know how to condense that as much as I can, but yeah.
What's one AI tool marketeer should try like today?
I would say ChatGPT because it's just the most readily accessible.
If you could change one thing in the industry, what would that be?
The hesitancy to be first.
That's a hard one.
Yeah.
What's your dream healthcare marketing innovation?
Oh God. An understanding regulatory team. No. No, I don't know if I can.
Those are all the difficult ones.
Yeah. Oh man, that's a tough one. Yeah, I think I'm assuming it's going to be something with leveraging AI to just, make a lot of my more menial day-to-day tasks like automated that I don't have to deal with. It would allow me to be more creative and strategic. That's a very long-winded answer to a rapid fire, but it's
excellent. No,
Yeah.
that was amazing. Thank you so much. So we have a little gift for you.
Awesome. Oh wow.
That's for you. Thank you. You can open it later.
Okay.
It's AI. It has to be AI. So moving to the next segment, we're calling it as a TNM playbook.
Okay.
Right? The idea here is we want to build like a playbook for young marketeers, which they can learn from leaders like yourself, right? From your experience, which they can use in their day-to-day life for campaign planning or other things that they do.
just how to get started in AI for somebody new to the industry in general. It sounds like very, very old fashioned, but I mean, honestly, like reading and like following up on everything and getting in, creating accounts yourself and like messing around and really seeing like what it can do. Because I think most people with even ChatGPT, you know, most people think it's like you're asking questions or creating images, but you can create PowerPoint decks, Excel documents. There's so much that you can do with it. And I think you don't know what you don't know. So it's like the more you can get in there and really be hands-on keyboards and mess around with a lot of these different platforms and learn what they do, it'll spark new ideas for you in different ways to use it. Because I'm sure the way I use ChatGPT is completely different from how you use it, and everyone else uses it. So it's, you know, it's one of those things where I don't think there's a step-by-step like do this, this, and this. It's like step one is like start messing around, experimenting, and learn like what it can potentially do, and see what ideas are really generated from that.
Let's move to the next segment, which is the most interesting one for me.
This
It's
the
a
switch?
tables turn.
Yes,
the switch.
which is
where the
since-
guest becomes the host and the host becomes the guest.
And since this is AI, I asked ChatGPT for questions to ask. So
So I should enable my voice interface of ChatGPT.
so let's see. First question. How do you see AI fundamentally reshaping patient engagement in pharma over the next 3 to 5 years?
So I see patients getting more informed and armed with knowledge, which they have been doing in the past with some plain Google searches. But now they will come back with more information and more questions. But when those questions comes, the physician would also be more charged up because of usage of AI and more personalized answers. So I feel in between when that trend came where the HCP patient relationship was a little challenged, where patient began to challenge the authenticity of the physician and the trust was dwindling a bit, I think it will kind of come at a level play.
Yeah.
Over a little period when they'll be charged with more information, adding trust layer to it.
Yeah, it's funny because I know doctors would be somewhat annoyed sometimes when patients would come with like their Google questions, and now it's
As
a
a
whole nother
physician-
level. It's you know,
As a physician, when a patient used to come to me, if you already know the answer, why are you asking me?
yeah, that's good. Next question: what AI-driven innovation are you personally most excited about right now?
See, for me, AI is like how internet was, like back in the 2000s, right? People saw it coming. They didn't see how it will change so much, how it will make everyone dependent on it, right? In like 5-10 years. I still remember like earlier days, there used to be dial-up internet, right? We had to dial up and the speeds were very limited.
And hope nobody picked up the other phone in the house.
Correct, and then the connection would get like disconnected, the computers were big, right? And like 10, 15, 20 years, everything has changed, right? Like I strongly believe AI is that kind of technology which will exactly change the way we work, the way we think, right? Like you said, would there be schools or colleges exist? Maybe not, right? The way they will be taught in school will be very different. Like my 9-year-old boy uses ChatGPT like all the time, right? It's very different from the time when we existed, we were 8. We didn't know how to do anything, right? Forget ChatGPT, right? So it will be a very, very different world, and the kind of problems we would be dealing with would be very different as well, right? Maybe it is humans versus ChatGPT that time.
Or Skynet, and that's the Terminator shows up. Oh, I think I'll let you off the hook after that. So.
Great, thank you so much. So any closing remarks?
No, I mean, the only thing I'll say that this is, I think you just touched on it, that this is a very exciting time because it does feel like Internet 1.0, and I'm just excited, a little nervous to see like where things are going to be in 3 to 5 years. But you know, if it's already come this far in 2 years, yeah, I'm really excited, looking forward to where it comes from.
Thank you so much for spending time.
Thank you for having me.
So if you can take a picture, taking a little Polaroid picture.
Sure. What
5 years will bring, I think is going to be very interesting. Let's put some of those regulators behind the AI, get them to understand the technology, what is possible with large language models, what's possible with agentic AI. I think they'll realize that it makes the process of bringing products to market faster, more effective, and allows marketing and promotion to be more seamless, not as clunky as it was 10 years ago.
Yeah.